Good morning, everybody. Pleasingly, New South Wales has satisfied another important hurdle. 75% of our state have at least the first dose of vaccine, and we will all rest easy once we get to at least 80% first dose, knowing full well that we'll hit that double 80% vaccination rate as soon as we can. 42% of our citizens are fully vaccinated, a number which is very pleasingly inching towards that 70% double vaccination rate we're all looking forward to, which we still estimate will be around mid-October. To 8 p.m. last night, there were 1,480 cases of community transmission and regrettably 9 deaths, and we extend our deepest condolences to the loved ones of those people who lost their lives with COVID. Dr. Gal today will in particular highlight the suburbs where we're calling out people to come and get vaccinated. It's really important for us to move forward, and whilst parts of Western Sydney and southwestern Sydney are demonstrating outstanding results, there are other parts of Greater Sydney that we'd like to see the vaccination rates go up, and Dr. Gal will call some of those areas up. And there are also areas where they join some of these communities and might actually be at risk of having more cases in the next few weeks, and we want to make sure that people are protected all around the state, but also that we all move forward to ensure we get those vaccination rates as high as possible. Very pleasingly today we have with us Professor Christine McCartney. She's a specialist at Sydney's Children's Hospital at Westmead, as well as a number of other important roles, and she's going to allay any concerns about the impact of Delta on children and how parents and children can move forward, especially with schools returning next month. And I really want to thank Professor McCartney for the great work she and her colleagues do, but also for the time today, which we know what a struggle it's been for families who are home learning, for parents who are overseeing home learning, as well as undertaking their own work responsibilities and household responsibilities. And we just want to say to everybody, thank you for your patience, and please have the opportunity to hear directly from an expert as to what Delta means for children, especially those under 12. Dr. Gow will now give the health update. The Deputy Premier will talk about the regions, and as we've foreshadowed, we'll be talking about what it means, what the future of lockdowns mean for regional New South Wales later this week, and then Professor McCartney will give her update. Thank you.
Thank you very much, Premier, and good morning, everybody. Till 8 p.m. last night, there were 1,480 locally acquired cases of COVID-19 in New South Wales, and there were 0 overseas acquired cases. We had 130,341 tests reported till 8 p.m. last night. So again, very good testing numbers, and thank you to everybody coming forward promptly for testing if you have even the mildest of symptoms. Currently, there are about 11,000 people with COVID-19 who are being cared for by New South Wales Health, and the vast majority of those, over 90%, are being cared for in the community or in New South Wales Health's special health accommodation. There are currently 1,136 people with COVID-19 admitted to hospital. 194 people are in intensive care, and 78 of those are currently requiring ventilation. Of the 194 people in ICU, 158 are not vaccinated. Sadly, today we are reporting the deaths of 9 people with COVID-19. They are a man in his 60s from Dubbo who died in Prince Alfred Hospital. He is not vaccinated. He was not vaccinated and had some significant underlying health conditions. We also report the death of a man in his 90s from southeastern Sydney who died at St George Hospital. He was a resident of the St George Aged Care Facility in Bexley, where he acquired his infection, and his death is the 3rd death linked to this aged care facility. We're also reporting the tragic death of a man in his 20s from Western Sydney who died in Nepean Hospital. He was not vaccinated and also had serious underlying health conditions. We are also reporting the death of a man in his 80s from southeastern Sydney who died at Prince of Wales, a woman in her 60s from Western Sydney, Agnes Banks, who died at Nepean Hospital, a man in his 70s from Western Sydney who died at St Vincent's Hospital, a man in his 80s from Western Sydney who died at Westmead Hospital, a man in his 70s from southwestern Sydney who died at Liverpool, and a man in his 40s from southwestern Sydney who also died at Liverpool Hospital. 7 of the 9 cases of people who died that we're reporting today were not vaccinated. 1 person had had 1 dose and 1 person had had 2 doses, and all those individuals had underlying health conditions. On behalf of New South Wales Health, I do extend my deepest sympathies to the families of those individuals who have lost their lives. Today I'd like to draw attention to a few areas for people to come forward for vaccination and for testing and to be aware particularly of symptoms. We've had a sewage detection in the Bonny Hills area of the mid-north coast. We're currently unaware of any cases in the Bonny Hills area, so if you do live locally, please be aware for symptoms and please come forward for testing. In terms of our suburbs of concern, we remain concerned about suburbs that we've previously mentioned in the Western Sydney and Southwestern Sydney area, and we encourage residents of those areas to come forward for vaccination as soon as you can. We're also concerned about case numbers in the areas of Glebe, Waterloo, Redfern and Marrickville, and I'd like to encourage the residents of those suburbs as well to please come forward for vaccination. The Sydney Local Health District has set up some special clinics, Pfizer clinics, where bookings can be made or walk-in appointments can be made for residents of those areas. And they are clinics at the Peter Forsyth Auditorium in Glebe, the PCYC in Marrickville and the West Leagues Club in Ashfield. So please, if you live in those suburbs, come forward to get vaccinated. Please look out for symptoms and get tested if you have even the mildest of symptoms. I'd also like to thank all residents of those 12 LGAs of concern in particular for coming forward. We're really seeing great vaccination numbers from people in those areas, which is fantastic. And I'd particularly like to ask people who live in suburbs around the Liverpool area and the suburbs around the Parramatta area as well to come forward for vaccination. So thank you very much.
Good morning, and could I start by offering my condolences to those families that lost loved ones. You remain in our thoughts and prayers. Up to 8 p.m. last night, Western New South Wales Local Health District, there were 27 new cases. 17 of those cases were in the Dubbo local government area, 6 in Burke, 1 in Walgett and 3 in the Bathurst local government area. In the Far West Local Health District, there were 7 cases. All 7 cases were in Wilcannia. In the Illawarra Shoalhaven region, overnight there were 34 cases. 24 cases were in the Wollongong local government area, 7 cases in the Shellharbour local government area, 2 cases from the Shoalhaven local government area, and there's 1 case currently under investigation in the Kiama LGA. In the Hunter New England Local Health District, we had 11 new cases overnight, 3 cases in Port Stephens local government area, 2 are in the Newcastle local government area, 5 from the Lake Macquarie local government area, and 1 from the Dungog local government area. Also on the Central Coast, 15 new cases on the Central Coast at 8 p.m. last night. Southern Highlands, we saw 5 new cases in the Windsor-Carriby Shire. 4 of those cases were in Woodlands and 1 case in Mittagong, in the Mittagong area. Southern New South Wales, there were 0 cases to 8 p.m. last night, but we've already been notified this morning. There are 2 additional cases, 1 in Batemans Bay, 1 in Cooma. The Bateman Bay's case is a close contact of a previous case that was announced a couple of days ago. Again, a call out to the community of Forbes. Fantastic result in the past 7 days. They've moved their first dose vaccination rate from 36% to 63%. And again, a call out to Regional Rural New South Wales is to get vaccinated. Walk-in clinics without bookings are becoming more available right across the region. Jump on the New South Wales website and find out where you can get the jab. Thank you.
Good morning, and thank you very much, Premier, for the invitation to attend today. From the National Centre for Immunisation Research and Surveillance, it's been our pleasure to be working very closely with the Ministry of Health, the Department of Education, and indeed principals, schools, directors and childcare centres, as well as, of course, families and kids, to be able to track the spread of COVID in educational facilities across New South Wales. We've actually been doing this since the beginning of the pandemic in March 2000 last year and delivering reports. Today we're releasing the 5th of those reports, which saw us cover the period from mid-June through to the end of July, 6 weeks, during which there were cases of COVID in 51 educational facilities across New South Wales. Important to note that there are almost 9,000 facilities, I think 3,100 schools and around 5,800 childcares. So of those 51 sites where there was a case, there was actually the majority that did not have any onward spread of the virus to teachers, staff or children in the educational facilities. What we saw was that the highest rate of spread was actually amongst unvaccinated adult staff, and particularly unvaccinated adult staff at the time of the report in childcare centres. The spread of virus also occurred from adults to children, but the spread between children themselves was very low. This really affirms what we know about the Delta virus. We have seen a higher rate overall of spread from the Delta virus as compared with what we saw last year, but in children in particular, the majority of children who have become infected have not had symptoms or had only mild symptoms. And this is certainly the case for the children infected in the educational centres as well. We have seen high spread of the virus in households, including in households after there had been a case at an educational centre, and we know that's primarily driven again by unvaccinated adults. Just a word on the infection in children. We're very lucky to know, and it's consistent with data over the course of the pandemic, that COVID-19 remains generally mild in children. Only around 2% will require hospitalisation, and for many of those 2%, it's actually for monitoring and social care. Unfortunately, often their parents are very unwell with COVID-19, and that's why they're being cared for in the hospital. We've seen extremely few children admitted to the intensive care unit. So I think there's a lot of detail in the report which I trust will very much inform and is informing the work of New South Wales Health and Education and the New South Wales Government in designing their strategies for the return to face-to-face learning in New South Wales. As a paediatrician and a parent, I know how important education is, and particularly face-to-face learning for children's well-being, development and mental health. And families have really been suffering during this time, and children have been, having a hard time. But there is light at the end of the tunnel, and it's really being delivered, I think, through COVID-safe practices designed in that roadmap to return, underpinned by the evidence and the continuous monitoring that we're doing. And absolutely, the biggest shout out from our perspective is for everyone eligible to please be vaccinated. Parents, young people, and even teenagers now from the age of 12, vaccine is available. This is just the greatest measure that we have to protect kids of any age. So thank you.
Professor, did your research look into the issue of airflow within schools and whether children were more likely to catch Delta in a space that has lower airflow? And was there any recommendation made around that?
So we know that ventilation is very important, and that's certainly a key element of COVID-safe practices in schools, having where it's possible outdoor learning. Our specific research hasn't correlated that with the outbreaks, but there's a lot more to come as we analyse the data from further weeks, which we're doing every single week and presenting to New South Wales Health.
Premier, is your on masks then for students and for teachers, Doctor?
Well, I defer to the Premier as well, but I know that advice is in the return to school plan, and certainly from age 12 and above, masks are to be implemented, is my understanding. But also masks can be worn by younger children, and I know that may be required in the future, and it's certainly a strong option for families to consider. And we're pleasingly seeing children come on board and wearing masks. They can do so in a safe way most of the time.
Is our government looking at employing or bringing in changes to school building infrastructure in terms of ventilation? I mean, we still hear about some schools where windows are painted shut, that sort of thing. They don't have great airflow.
Yeah, look, as the Professor has outlined, the return to school plan was done in consultation with our health experts. In a staged way, in a very safe way, and obviously in the warmer months you can have windows open and doors open and improve ventilation. So the plan is very much based on what is a safe way to return to school, to obviously assist in getting us back to normal as possible, but especially acknowledging what a difficult time it's been for families and for children. Face-to-face learning is obviously the optimum way for children to learn, and we are absolutely confident that the plans that have been put together in consultation with our health experts and education do have that safe return to school. We have outlined details of that plan already, but obviously as we get closer to that date, if there are any tweaks that need to be required, they'll be implemented. But as we've said, these plans were put in place in a very detailed and consultative way, in a staged way, to make sure it's safe for all concerned. And as Professor McInerney outlined, the safest way to protect children is to have high vaccination rates amongst adults and obviously adolescents, and that's why we have had a very strong focus on making sure as many adults as possible are vaccinated, to make sure all of our teachers and school staff are vaccinated. That is the best way to protect children and the best way to prevent the spread in any school setting. But also, as we've heard, 51 out of thousands and thousands of settings isn't a large number, but we know that when it's your school and your child, what that could mean, and that's why we're doing everything we can to prepare the safest return to school as quickly as possible.
Premier, acknowledge that this isn't totally reflective of having, during this period there's weren't a lot of kids at school. In this term, in term 3, there's been not that many kids at school. So just in terms of, they're saying in this research that there's not a lot of spread between child to child, but can we sort of trust that looking forward in terms of, when classes are full?
Well, I think I'll ask the Professor to answer that question.
Yeah, thanks very much for the question. So, oh, sorry, my mask. Thank you. So, look, absolutely, this research is ongoing, and you can see in the report that following on from the 51 schools, there are a further 92 schools up until the 19th of August, and of course there have been more schools since then. So we're in the process of looking very closely at what settings schools had at the time that a case was introduced. We know from the first 51 schools that 10 of them were at level 1, which is normal COVID safe practices, and out of those 10, there was no transmission in 8 of those schools, so full attendance, COVID safe practices. But of course, this will vary with the level of transmission in the community, and our work is going to correlate that. The most important thing again is that if we look back at this time period, we had very few adult staff vaccinated relative to where we are now, and the vaccination rates of staff and indeed the teenagers themselves is really critical as we see attendance rates return to more normal levels in schools.
Deputy Premier, which areas of regional New South Wales are most likely to be assessed for coming out of lockdown? Is it the north of the state and the Riverina that have the most possibility? And if they are released, if they get a case next week or next month, will they go back into lockdown?
Well, firstly, no decision's been made in relation to any areas coming out of lockdown in regional rural New South Wales, but the most likely areas, if you're going to consider it, is areas that have no cases. It's simple as that, no cases. And if we do make the decision in relation to opening, and that is up to the health advice, to the crisis committee, and we'll make those decisions and we'll let the community know shortly. Absolutely, if a case arises, we will apply the same logic that we applied from day one, which was the orange case, where we put that community to lockdown, and we would lock down automatically an area for at least a 14-day period, which is the incubation period.
And if some regions come out of lockdown, will they return to pre-lockdown restrictions? For example, if you've got retail and restaurants opening up to everyone, including the unvaccinated, at some point do they join the rest of the state and switch to vaccinated only? Is that a bit back to front?
They're really good questions. The reality is that we haven't made decisions, but I don't believe that if we do open the regions up, we'll be opening them up to an environment pre-lockdown. I think there's a reality out there that there are a number of cases in regional and rural New South Wales. There is sewage surveillance, there is risk, but we balance that risk. So there is an opportunity open, but I would argue that the opening of the regions, if it happens, would be in a very restricted environment. Still nothing like the environment pre the lockdown. If and when we announce the roadmap and we talk about the vaccinated, it's clear those that are unvaccinated in regional rural New South Wales, if they may have a freedom because they've been lifted from a restriction now, will lose that freedom. I make that absolutely blunt and make that clear. The vaccination rates in regional rural New South Wales have to continue to rise on par with what's happening in Metro Sydney and the state average. And therefore, the pressure point must apply that for some people in the regions, if we ever get to that point, if they come out of lockdowns now, could go backwards and could lose freedoms if they're unvaccinated, and I make no apology for that.
When are we going to get an update of the restriction settings, particularly for the 12 local government areas of concern? We've got Burwood that, you know, in comparison to the City of Sydney, doesn't have many cases at all, but they're in a hard lockdown and the City of Sydney is not. When are we going to see that updating and some released? And
well, it's important to note that in relation to any area of concern, it's based on head of population. So some councils have smaller populations than others, so you can't just do it on a case-by-case comparison. You have to make sure you're doing it per 100,000 population, which is what our health experts do. But I will say this, every day we scrutinise everything very, very closely. We know from the modelling that the worst weeks in terms of case numbers are likely to be in the next week or so, and as you see, we need to make sure that we don't cause any major adjustment which is going to see a skyrocketing of cases. So we've done very well in keeping the case numbers where they are, even though they're very high. But as I've said, what is really important is keeping our eye focused on the vaccination rate and also how many people end up in ICU. But we're having those discussions about the roadmap every day and what life looks like. And I'll stress again that at 70% double dose vaccination, everybody who is vaccinated at 70% double dose vaccination will enjoy much more freedom than what we experience today. And we'll have more to say about that once we make those decisions.
Will they enjoy the same freedom?
Well, at this stage, we're having conversations about what the roadmap, well, to be honest, it's the final touches. The roadmap is essentially in very good shape. We've made great progress. It's based on the Doherty report and the Doherty research and the national plan, and we have to be very consistent with the national plan. And there are certain conditions of opening at 70% double dose, and certainly we'll meet all those conditions. But I'm extremely optimistic that at 70% double dose, everybody who is vaccinated will enjoy life much more freely than what we do today, and that's a commitment we've made from day one.
Some LGAs and those of concern, if they don't have the requisite number of vaccinations and if they still have high cases, that they won't get the same freedoms as other areas of Sydney that do.
Well, the great news is that those areas of concern are outstripping the rest of the Greater Sydney area in terms of vaccination rates. So it's extremely pleasing that the vaccination rates in those local government areas of concern are very high. What is still concerning us is that 80% of cases are still in those areas of concern, and we'd like to, one second, I'll get to you, and we'd like to obviously see that decrease, and there are glimmers of hope that some areas are seeing a stabilisation. And once we know it's safe enough, it doesn't matter where you live in the state, whether you live in Sydney or whether you live in the regions. If there's anything we can do to ease the burden of what everybody's been through, we will do that. It's never been our intention to put more pressure on people than we need to, and that's been our position from day one of the pandemic. Sorry, your question?
Yes, the communities from the 12 LGAs of concern have been crying double standards for the past 10 weeks. When do they stop becoming the 12 LGAs of concern? You've thanked them today, you said outstanding vaccinations. We know the virus is all over the state now. When do they just become treated like everybody else?
I mean, I experience, as well as our team, the day-to-day distress and trauma of people losing loved ones, of people ending up in hospital very sick for weeks and weeks. And our intention from day one has been to prevent death and to prevent hospitalisation and to support communities in as safe a way as possible. And I'd rather be having this conversation than having a conversation as to why we allowed thousands of people to die and why thousands of people suffered. I'd rather have this conversation than a conversation about consoling thousands and thousands of families who'd lost loved ones. None of this is easy, and I'll be the last person to suggest that. Try being in my shoes for a week. And none of this is easy, but every decision we take is to support our communities, is to protect people's lives and to allow us onto that path of freedom. And I'd much rather be having this conversation than a conversation about why we failed communities and had thousands of people die.
But do you feel like the message has gotten through to these communities? I mean,
Well,
you've been pushing the message in different languages, but you're saying that the numbers are still highest there. Why is that?
Well, I'm so heartened that at the beginning of the process, when I spoke to community leaders and when we dealt with very diverse and distinct communities, there was a lot of hesitation about the vaccine. And now we've seen those communities step up and have the highest rates in the state. I mean, Blacktown's at 88% nearly, a first dose. That is outstanding. We've seen an enormous turnaround, and the vast majority of people appreciate how difficult life is, but the vast majority also appreciate that it keeps their closest ones safe, it keeps their loved ones safe. And again, I'd rather be having this conversation than the alternative conversation, which would be why did we allow thousands of people to die? My job is to protect the community. It doesn't always make me popular, but I'm pleased to do it because I shouldn't be in the job if that's not my motivation. And if I felt for a day that we were letting down the community, I would certainly not make decisions in that regard. But our decisions first and foremost are to protect life, to keep people out of intensive care, and to protect the community so that when we do open up, the vulnerable are taken care of. And for many of those communities, the vulnerable, obviously there's challenges in all parts of Sydney, all parts of the bush. So what we're doing now is, given we're at 75% first dose, which is fantastic, I won't sleep until we get over 80% first dose, because then I'll know that we're getting to that 80% double dose, because once you've signed up for the first one, you're going to get the second one. But what we're doing now is looking at those pockets where the vaccination rate for one reason or another is a bit lower, to make sure we boost that. But I just want to stress the point again. Every day I ask the health team, and you can ask Dr. Chant because I annoy her every day, is there anything we can do to ease the stress on our citizens? But I can't afford, and we can't afford, to ignore the health advice, because then we see the trajectory go worse, and then we see all of us held back when there's too much disease in the community. And with schools opening up, our ideal is, and with all of us opening up in October, we want to see the case numbers and the proportion of disease as low as possible, so that when we open up, we don't have to worry too much about the disease spreading amongst those who aren't vaccinated, or allowing the hospital system to be overrun. These are all very complex decisions, and again, we make them to protect lives, not to be popular, and I don't really care about that, because I want to look back to make sure that every day we did our best to keep people out of hospital, to keep people alive, but also to provide that vital information. And I know, within my own circle, that there are there were various myths going around about vaccination, and that's been overcome. I'm so proud of communities and community leaders who've stepped up and helped us. Because if it wasn't for the community leaders helping us, telling us where people were comfortable getting vaccinated, telling us what the challenges were and encouraging people, we wouldn't be in the position we are today. We are weeks ahead of any other state, because we've really worked hard to support the most vulnerable, to support those who may have been given misinformation, and I'm incredibly proud of where we're up to, and there's more work to be done. But I'm confident the track we've been on, as difficult as it's been, is starting to bear fruit. Things are starting to change in terms of the trends that we're seeing, and we obviously want to see those trends concerned. So even though we're seeing case numbers very volatile, and as the modelling showed, we're expecting the peak sometime next week, please know that at any stage, if we do something that changes that modelling, if we do something drastic that changes that modelling too soon, we won't be able to stick to the plan. So it's just a delicate balance of protecting people, but also giving them the freedoms that we can. And that's a delicate balance that we have to undertake every single day.
Premier, I know the Deputy has spoken about this, but people who live, say, on the mid-North Coast, the North Coast, Riverina, where there haven't been any cases, can they be confident they won't be in lockdown this weekend?
Well, that's why we have to go to the health advice, and their decisions we'll be taking. Obviously, we review those decisions, and the health experts give us their advice. And
What's the advice? It's only 2 days away.
Well, no, it's ongoing, because...
but the lockdown ends at 11:59 Friday night.
Correct, and we said that we'd let you know by the end of this week, which we will.
Is it likely to be an immediate lift, or would you say in a week's time or on this future date those
we always like to tell people what to expect beyond a particular date, and we've always said we'll let the rural and regional communities know with enough notice what life is like from September 11. So that's certainly always our intention.
There's not really much notice though, is it?
Oh, well, I think communities are prepared either way. We're a pretty resilient population, and we've learnt to deal with what a pandemic means. A pandemic means that you base your evidence, your advice on the best health advice at a particular point in time, and you make sure that you provide comprehensive information when you get it. So we'll be going through those processes this afternoon, and we hope to be in a position to advise the community tomorrow.
Hotel quarantine to be potentially wound back before we reach 80% double dose in Sydney, in terms of, in favour of moving people to home quarantine and even potentially a shorter 7-day quarantine?
Well, certainly between 70% and 80%, there's no doubt we'll be going through a transition. And I think there is an argument for us to consider very closely what quarantine for returning Australians who are fully vaccinated looks like. So we're actually making those considerations now. So we're looking through what is a safe way to manage that. We will, from 70% double dose to 80% double dose, we definitely will be in transition with our quarantine system. As we said, overnight, I think we had 2 cases overseas. It's important to quarantine because the cases may develop in the second week, and yet thousands of cases still in the community. So there will be a transition in the quarantine system from 70% double dose to 80% double dose, and once we hit 80% double dose, we will definitely be opening up Sydney Airport to welcome home Australians, and with less pressure on having them in the quarantine system, it actually means we can welcome home more Australians who are double dose vaccinated, because they will essentially be required to be in quarantine for a period of time, and the health experts will give us guidance on what length that should be. I know in some countries it's as low as 7 days, and it might be that when they land they take a quick test, and if it's negative there might be a shorter time period if they're double dosed. But in any event, we're relying on the health advice to help us guide our decision making, but I'm confident that there'll be a definite transition between 70% double dose and 80%, and in fact there are draft papers that we're working on at the moment, and I'm pleased to show other states how that's possible, and we'll welcome home Australians from all states as a sign of good faith, as our contribution to the national plan, and as a contribution to say you can live with COVID, as difficult as it is, and you can welcome home Australians, reunite families without jeopardising life, because by 80% double dose, everybody will know the risks, everybody would have had the opportunity to get vaccinated and protect their families and themselves, and life will be very different to what it is today.
Premier,
just a follow-up,
System, sorry, because at the moment the trial that's underway in South Australia means facial recognition technology scanning for home quarantine. Are you comfortable with that technology in terms of safety and security?
Well, we were really interested in the South Australian model, and we've actually looked at how that works. And I know that we have the various technology platforms available, but it also does require people to give up a little bit of privacy if that's the way they want to do it. So we are considering all those issues, and it might come down to, if you're prepared to give up a little bit of privacy, you can then quarantine at home. And these are the conversations we're having and the discussions we're having, but it could very well be the case. But there's no doubt that in a pandemic, if we're trusting people to quarantine at home, and some health experts aren't comfortable with that, a lot of health experts would say would prefer them to be in a known location, but if they've been vaccinated with a credible vaccine which is has high efficacy, and they can be monitored whilst they're at home, there's opportunities for us to move to that model between 70 and 80% double dose.
Premier, you say that you're, we're 2 weeks ahead of the rest of the country in terms of vaccinations. One of the reasons for that, of course, is because we've been given extra vaccines. A lot of the premiers interstate are upset about that. Federal government says it's going to make amends on the numbers and distribution. What's it going to mean to us if they do start slowing down supply to New South Wales? And is it fair? And should we have to give back doses to the rest of the country?
Well, firstly, I remember being highly criticised for suggesting that, along with Dr. Chant, of course, that vaccination was the way out of this outbreak and we had to live with COVID. So we made a very hearty effort in New South Wales early on, even before the Delta outbreak, to vaccinate as much of our population as possible, as early as possible. We had 100 sites already set up across the state. The GP network we've been working with. Other states don't have as strong a GP network as we do, and I really want to thank the GPs who've been consistently working with us. They've been delivering a lot of the vaccine and they'll continue to do more. The pharmacists who came online. So we've had a strategy for some months about vaccinating our population as quickly as possible. And certainly, it didn't take long within the first few days of the Delta outbreak for us to know, once we'd been in lockdown, that this was different to anything we'd experienced. We had to learn to live with it, and that vaccine was the only way out. Other states obviously haven't had to go through what we have, and they're obviously in a bit of catch-up mode. But I would suggest it's because of the risk and the outbreak that New South Wales has faced that we've appreciated that our best way to protect life and not to lose thousands of lives and hundreds of lives every month is to make sure we provide vaccine. And we've also been pushing both vaccines. We have a high increasing take-up of both vaccines. AstraZeneca is in ample supply. And we say to anybody, if you're worried about taking that vaccine, go speak to your GP and make sure you're aware of what your concerns are. But on the main, we've just said whatever vaccine is available, assess your own health risks and get vaccinated. And the people of the state have rolled up their sleeves and done so.
Premier, you're starting to talk about international travel, and we know that the federal government is pushing the vaccine passport from October. But a lot of people are, seeking something a little closer to home and still wondering about domestic borders. I know maybe, WA and Queensland might be a different kettle of fish, but can you give any guarantee to New South Wales that they would be able to travel to see families, say, in Victoria by Christmas?
Oh, look, that's definitely my hope, and I'm convinced that Victoria in particular will get to 80% double dose, not too far behind New South Wales. So I have absolute confidence that there will be much more movement within Australia, because hopefully what we'll be able to show in New South Wales is, even though we'll have, because of our population, our density, and when the outbreak hit, because our vaccination rates were very low when the outbreak really hit, whereas in Melbourne the vaccination rates are a bit higher when they're going through their outbreak. So if people can see the way that we've managed it, and it's still a way to go, we're not out of the woods. I mean, September, October are critical, we've always said that. But hopefully other states will see the way New South Wales has managed to get through this and then feel more confident about their own situation. And I'm confident that there's already been a shift in thinking. I've really felt that. There's already been a shift in the conversation we're all having as Australians, and I think that will gain more momentum as many citizens around the nation say, hang on, I've not seen my parents, or my parents haven't seen my child ever. And I think the public will start really speaking up and saying, we've accepted the challenges of living with COVID, we're up for taking the risk, we're vaccinated, so let us reunite with our families or conduct business or travel for relief after mental anguish of so many months. So I'm absolutely confident that other states will come on board, and I'm confident Victoria and New South Wales will work together to make that happen.
Premier, a question about Indigenous populations, especially in a town...
so did you ask the Deputy Premier?
Yes, the Deputy Premier, sorry. We've been talking to communities in Gonia with largely Indigenous populations there. A woman passed away actually 2 days ago, and they're struggling with food supplies. Now, we know that some families outside of the lockdown area try to get in there and get them food, but the police actually stop them and threaten them. First, can the police do that, and what is being done to help the families locked down in Ngonia?
Well, the first thing is, of course, the police have the ability to make sure that anyone that's entering regional rural New South Wales has done so as authorised, and they are authorised. I understand that particular scenario. In the end, the food got to its destination. And I know there are so many Sydney communities and community groups that want to assist Indigenous communities in the regions, and that's what I love about Australia. And when things get tough, everyone rolls up their sleeves and supports us. I saw that support during bushfires, during floods, and now with COVID. In relation to food supplies in regional rural New South Wales, when it comes to our Indigenous communities, we gave $10 million to Food Bank and Oz Harvest to support those communities. I know that those communities are being supported. We also have other arrangements. We made an announcement the other day about supporting more smaller groups or individuals that are supporting communities, and we'll continue to do that. The Department of Resilience, Department of Health, DPC, Police, we're all working together at a very local level, and I love seeing that kindness. Yes, there was a hiccup there, but in the end, their generous approach was something that was welcomed, and I'd love to see more of it. But we do have to be careful. Can I just make this clear? The regional rural New South Wales do have a level of anxiety about people leaving Sydney. It's why we have a level of restrictions on the movement of people out of Sydney, authorised workers, having testing 7 days prior to leaving, getting a permit system. All of that is in place is to protect the regions in the first instance, and that is always going to be our priority. And I support the police when it comes to compliance, that they actually try and push that through. And unfortunately, they were pulled up but in the end their generosity did reach the destination.
Idea of how transmission is occurring on the Central Coast. It's a fairly large LGA. Is construction a concern in that area?
Look, there's been a mix. The Central Coast is an interconnected community with Sydney. There is a movement through authorised workers in and out of the Central Coast and Sydney. We know there was a construction site last week, a number of workers on that construction site, and there was a case that has been an issue for the government, and we keep watching what's occurring on the Central Coast. Can I just say about the Central Coast as well, their vaccination rates are continuing to climb. Is it high enough? No. The purpose of our only passport out of this is through vaccination, and the cases we're seeing in Illawarra or the Central Coast or in the Hunter area are stubborn. They seem to be consistent, but what can I say? The community are coming out, getting tested, and the alternate is making sure we get vaccinated.
HSC test.
I'll come to that.
In relation to schools, but just back on the issue of ventilation monitoring, are there technologies that we're looking at putting in schools to look at airflow? I know obviously in summer you can open the windows, but it's going to be ongoing.
Yeah, obviously the best thing to do is to use existing infrastructure, and the best way to get increased ventilation. So we're looking at all those issues. The warmer months actually help us incredibly, as well as alternatives for outdoor learning, but also accepting that with a staged approach, some years we'll have the entire school to themselves. So we'll be able to have ample social distancing, and by that stage, by the time you have all students back to getting some kind of face-to-face learning, we'll be pretty much close to 80% double dose vaccination. So we've done that staggered approach intentionally to have safety top of mind. And we've been, really pleased to have the expert advice of people like Professor McCartney and others who have supported education and health in coming to the conclusions we did in a safe return to school. Chris?
Premier, just on schools again, I guess HSC students particularly, I believe that Crisis Cabinet is talking about HSC results and the timetable planning today. Can we guarantee that any delays to HSC exams won't deprive any kids of spots in university going forward?
Can I confirm that those discussions have already taken place? We've already made decisions around that, and the Education Minister, the Education Department have consulted broadly with the university sector, and the feedback I've received is that we've had very favourable consideration, which was a similar consideration the universities gave Victorian students last year, is that they could accommodate the later exams and make the assessments. It does mean some people have to work outside the public holidays, but over Christmas and New Year, to make sure those assessments are made by mid-January. So we have received very positive feedback from the tertiary sector that they're able to make sure that no students disadvantaged, and Victorian students went through this last year, and I suspect we'll go through it again. So where Victoria and New South Wales is concerned, it's in the interests of the universities to work with us, and they've been very, very positive, can I say, in their comments. And the advice we actually received before we made decisions about the date of the HSC, and the advice we received, those consultations had occurred, and that's why we confidently moved to the date we did. And the Education Minister will have to give further details though once the Standards Authority gets back to us on what subjects will require a public exam versus those that may require others, and we'll provide confirmation about that soon. Thank you, everybody. Thank you.
Dr. Gale, just ask one quick question, Dr. Gale. Dr. Gale.